Okay, let's unpack this. I want you to imagine taking a medication every single day, just
Right.
waiting for this dark cloud of depression to finally lift. But then you find out the pill you're swallowing is, well, it's biologically designed to make your specific condition worse.
Yeah. Which is just a terrifying thought.
It really is. And today we're taking a deep dive into this crucial blind spot in mental health treatment because, countless individuals are completely stuck in this cycle of ineffective care.
Hmm.
And we're also going to look at a modern telehealth solution. Specifically, we're pulling from a clinical brief by Coping and Healing Counseling, or CHC, who are actively trying to fix this.
Yeah, and it's a massive issue. It happens far more often than we think, especially in the realm of mood disorders.
So to kind of frame this, getting the wrong mental health diagnosis, to me, it's like wearing the wrong prescription glasses.
Oh, that's a great way to put it.
Right, like you put them on hoping to finally see clearly, but not only does it not fix your blurry vision, it actually gives you this massive headache on top of it.
Exactly.
Yeah.
You're actually worse off than when you started.
Yeah.
And setting the stage for today, our focus isn't just that, clinical errors happen. We really want to get into why this matters so much biologically and how new screening approaches are finally catching these errors.
Which brings us right into the specific trap the source highlights. We're looking at patients who are repeatedly treated for depression, just over and over again without success.
Right. The clinical term for that is treatment-resistant depression.
And the statistic from the briefing on this is, well, it's honestly staggering. It notes that roughly 25 to 50% of adult patients labeled with treatment-resistant depression actually have an undiagnosed bipolar spectrum condition.
Up to half of them.
Up to half. I mean, wait, really? That's 50%.
Yeah, it's a huge segment of the population. They're dealing with an entirely different brain architecture, basically.
Okay, I have to push back a little here, though. Looking at those numbers, isn't the phrase treatment-resistant just, well, a bit misleading?
How do you mean?
It makes it sound like the patient or the disease itself is just being stubborn.
Oh, sure.
When in reality, if half these cases are actually bipolar spectrum, the medical label itself might just be totally wrong. You aren't resisting treatment, you're just being given the wrong prescription.
What's fascinating here is that you're entirely right to question that. Clinically, the label just describes the symptoms' behavior, right? The depression isn't lifting,
Right.
but it's a terrible label for morale. And the source emphasizes that the treatment for bipolar disorder is very, very different from depression.
So using a standard antidepressant is just a fundamental mismatch then.
Completely. Standard antidepressants, like your typical SSRIs, they boost serotonin. If you have unipolar depression, that helps.
It lifts the baseline.
Exactly.
Oh.
But a bipolar brain doesn't just need a lift, it needs stabilization. So if you flood a bipolar brain with serotonin without a mood stabilizer, it's like pouring gasoline on a fire.
Oh.
Yeah, it can trigger rapid mood cycling or push someone straight into a manic or hypomanic state. The medication is biologically inappropriate.
Which explains why it makes things worse. But since the treatments are so vastly different, the obvious question is, how? How do clinicians and patients miss this 25 to 50% of the time?
Well, to understand that, we have to look at the hidden signs of bipolar 2, specifically.
Because the documentation mentions it's easy to miss, right, but also highly treatable when you catch it.
Yes, very treatable. But the symptoms don't always look like what people expect.
Right. The source lists some specific signs where a depression diagnosis might not fit, like periods of feeling unusually energized, or, not sleeping but not feeling tired, starting big, massive projects out of nowhere, or just spending money and acting impulsively.
And those are classic hypomanic symptoms.
It's like, okay, think about taking your car to the mechanic.
Okay.
You go in, and you only complain that the engine keeps stalling out. Like, it just dies at stoplights. That's the depression.
Right, that's what's bothering you.
But you completely forget to mention that sometimes the engine randomly revs uncontrollably on its own and you're speeding up without touching the gas.
Yes.
If the mechanic only knows about the stalling, they're going to fix the wrong part.
That is a perfect analogy.
Yeah.
Because you have to think about why people go to the doctor.
They go when they feel bad.
Exactly. They seek help for the stalling engine because it's ruining their life. But imagine a patient who's been deeply depressed for months. Suddenly they shift into hypomania, high energy, needing less sleep.
Starting projects.
Yeah. To them, that doesn't feel like an illness. It feels like a massive relief.
They're probably thinking, I'm finally having a good week.
Exactly. They don't report the revving engine to their doctor because, well, they actually enjoyed the speed. It just flies completely under the radar.
Wow, that makes so much sense. So, knowing this dangerous gap exists, we have to talk about how patients can actually bridge it.
Without facing massive hurdles, right?
Right, and this is where that clinical framework from Coping and Healing Counseling, or CHC, comes in. They're based in Georgia, and their model is it's really built to catch this.
Yeah, their footprint is entirely designed around access.
100% telehealth, IPA compliant, and serving all 159 counties in Georgia.
Which is huge considering the geographic barriers most people face.
And the team is really robust. The source mentions they have a diverse, culturally competent team of over 15 licensed therapists.
LCSWs, LPCs, LMFTs.
Exactly. And they handle specialties way beyond just bipolar, anxiety, depression, trauma, PTSD, other mood disorders.
And that diversity in the clinical team is so vital. Cultural competence directly impacts how symptoms are interpreted, which helps prevent these exact misdiagnoses.
And they tackle the financial side, too. For Medicaid, it's a $0 copay.
That's amazing.
Yeah, and for major insurances, they list Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. It's just $25 to $40 a session.
Making it actually realistic for people to get continuous care.
But here's where it gets really interesting to me. The actionable step. They use this 2-minute pre-referral online screener.
The MDQ style screener.
Yeah, the mood disorder questionnaire. It's completely free at chctherapy.com/mental-health-tests.
Right.
How empowering is that? The first step to untangling a potentially years-long misdiagnosis isn't some expensive, intimidating specialist visit. It's literally a free 2-minute online quiz.
If we connect this to the bigger picture, that screener is brilliant because it removes the friction. But identifying the problem is only half the battle, right?
Of course.
What CHC does next is what actually changes lives. They offer full evaluations via telehealth, but with integrated medication management coordination.
You can reach them by calling 404-832-0110 for that, by the way. But wait, what does integrated coordination actually look like in practice?
It means the therapist who spots your hypomania is directly coordinating with the person writing your prescriptions.
Oh, so the left hand knows what the right hand is doing.
Exactly. Having a diverse team that coordinates the right medication via accessible telehealth across all those counties, that is what actually turns a correct diagnosis into effective healing.
You don't just get a new label, you get a safely adjusted treatment plan.
Precisely.
So for you listening right now, whether you live in Georgia or not, understanding these distinct, easily missed signs of bipolar 2 is just so important.
It really is.
Like the impulsive spending or suddenly starting massive projects. Recognizing that could be the key to unlocking proper care for yourself or, someone you love who is stuck in that treatment-resistant limbo.
Because knowledge really is most valuable when you apply it. Taking a simple second look at your own symptoms could completely shift your mental health trajectory.
It's just a matter of having the right lens. Which leads us to a final thought for you to ponder. If our traditional diagnostic frameworks are so heavily focused on identifying the lows of depression that we completely miss the highs in up to half of all treatment-resistant cases, what other aspects of our mental and emotional lives are we fundamentally misunderstanding simply because we don't have the right vocabulary to describe the full picture to our doctors?
That is a profound question. We really need to look at the whole picture.
Absolutely. Thanks for joining us on this deep dive. Take care of yourselves, and we'll see you next time.